Hiya, it's Stephen Ojari here from Bannerdale Osteopaths. I just wanted to run through our virtual osteopathy service because, on first impressions, it sounds a little bit crazy, right? Yeah, sort of trying to help people in a virtual environment when we are sort of, by definition, manual therapists. So I wanted to just run through the process of how the encounter happens and how we actually get people better in a very similar sort of time frame to how we have done traditionally, using a much more hands-on approach. So osteopaths, chiropractors, physios to that degree are all sort of primary healthcare practitioners, and that means that we make a diagnosis and then go about trying to help people by designing a program of rehabilitation. Now, most of the training that osteopaths require, the sort of 4 years at least, is in the understanding people and sort of diagnosing and working out how we're going to get people better. So that's where the skill of a good osteopath comes in, is working out how to get from where someone currently is, which is not where they want to be, or they wouldn't be coming in, either through pain, which is a common sort of presenting complaint, or lack of performance through sort of sports or just daily activities. So it's from finding out where they are and understanding that, then working out what's happening. So there might be some injured tissues, there may just be areas of the body that aren't quite functioning properly. Then we want to work out where they want to be, and then we have to take them from A to B to get them better. So all this can happen very much to the same degree using the virtual service. Now, what we use is a system called PhysiApp, and what that involves is when we undertake the virtual consultation, we're both sat at our computers, or you might be at a smartphone, so we're sat face to face, so we can have the first part of a consultation in almost exactly the same way as we would if you came into the clinic. We're discussing the problem, and that's where generally the rule of thumb is that 80% of the diagnosis occurs in the case history, and that's a widely regarded figure that goes across all of medicine, really. So after we've talked through it, we've generally got pretty much an idea of what we think is going on. Then we set about asking you to do some movements, which we can do perfectly well using the virtual service. What we have as part of the PhysiApp service is we have the ability to pop up on your screen a video of exactly what we want you to do, that's audio descriptive, so it talks you through it at the same time as showing you. So we can either get you to do that, or we can simply say, can you do these movements, and tell me how they feel. So the examination maybe takes a little bit longer than it would do in the clinic, because what I can't do is pick up your leg and assess your hip. I've got to get you to do it, so there's a little bit longer taken in that. But by the end of it, the diagnosis that we come to is as accurate as it would be in the clinic. It's very rare that someone would require sort of scans or imaging or really sort of in-depth clinical sort of tests that we do. And if that is the case, then we're in a position where we would be referring you, and we would still do the same thing about to an NHS system that is trying to avoid anything that isn't essential. So there might be a bit more of a delay. So once we've come about working out what the problem is and why it is, the idea is to understand it in the context of your life. So working out what it is that you're doing or not doing that may be contributing to that. So that can all happen as it would do before, because a lot of that is discussion and sort of trying to work out what's your desk environment like. Now, a lot of people at the moment are working at home, hunched over their sort of table at home, and it's not perfect, so there might be changes we can make to the ergonomics. The primary bit of the plan, though, however, will be the exercise program that we set about, and that will involve a battery of different sort of exercises that we all agree between us in the consultation. Now, they will come to you that you can access either through your laptop, through your smartphone as an app, and they will come up as the videos as we've sort of gone through in the consultation, so you can watch them as many times as you like. And what your job is to do is to engage with the program. After you do the exercises, you mark how many you did and sort of essentially how they went. So that's on a pain scale, so a smiley face and a frowny face, and you jot on there where you felt it was pain level, and any comments that you feel that might be relevant. So it will usually in the video describe where you should be feeling the stretch, and I'll have maybe told you how it might feel and what it's aiming to address. So if this feels completely different to what you're experiencing, then that's something to write in the comments. And all these comments come straight up onto my dashboard for you. And I, every day, go in and review everyone's progress. So I'm looking to see if people are progressing as I expect. If they're not, then I get in touch via the PhysiApp system, sending a message, and maybe sort of suggest either another appointment to go through things if it looks like everything's sort of out of kilter with where we expect it to be, or we maybe just make some chat and sort of refine the sort of program down a little bit. So this goes on for as long as it needs to, really, and we can communicate as much as we like. We can set appointments. Some people find that they need quite a few appointments to run through it, and they get a lot more out of that. Other people are quite happy managing through the PhysiApp system and sending a message each day as they're doing, or when I ask a question as to, are you ready to sort of make this exercise a bit harder, or is it still feeling like it's hitting the spot, and we can go through it like that. So the system's quite malleable in that we can tailor it to you, and that's the idea behind it. So we've had a good number of people on the service so far, and we've not noticed any difference in the actual sort of number that are recovering. They're recovering well in line with what we'd expect from our clinic, and the speed of recovery possibly sort of 10 to 15% slower than in clinic, if I'm being totally honest. But we're not seeing that people are just not getting better, and we're not seeing that there's anyone that we're having to refer off because we can't work out what's going on. So I'd say that the system does seem to be working, and I'd encourage you to have a look. If you've got any questions, drop us a line. You can contact us on Facebook, you can give us a call, you can drop me an email. I'm happy to answer questions, and I hope to see you in my clinic. This is my clinic very soon. So take care and see you soon.